Welcome to the third video in our series on shock in children. The third type of shock that occurs in children is cardiogenic shock, although it is uncommon. Cardiogenic shock occurs when there is an impairment of heart contractility and the heart does not pump enough blood or oxygen to vital organs. The ventricles of the heart stop functioning properly, resulting in inadequate circulation of blood throughout the body and an impairment that makes it harder for metabolic demands of tissue to be met. Recognizing this condition and its signs during the early onset can make treatment more effective. Cardiogenic shock can be identified by a variable preload, decreased contractility, and an increased afterload. One of the most common causes of cardiogenic shock is myocarditis. Other causes of cardiogenic shock include congenital heart disease, sepsis, cardiomyopathy, arrhythmias, trauma, and drug toxicity. Some common signs that may indicate a child is suffering from cardiogenic shock are varied and include tachypnea, increased respiratory effort due to pulmonary edema, tachycardia, weak or absent peripheral pulses, pulmonary edema, jugular venous distension, cyanosis, change in mental status, olguria, cold pale skin, and varying body temperature. To manage cardiogenic shock, first, give the patient oxygen and support ventilation. Obtain vascular access and get lab tests and blood work. Administer a bolus of isotonic crystalloid in a dose of 5 to 10 milliliters per kilograms, slowly over 10 to 20 minutes as needed. Then conduct ancillary studies and obtain an assessment for pulmonary edema. Administer the following 4 medications. A catecholamine of dobutamine in a dose of 2 to 20 micrograms per kilogram per minute via IV or IO. A catecholamine of dopamine in a dose of 2 to 20 micrograms per kilogram per minute via IV or IO. A vasodilator of nitroglycerin in a dose of 0.25 to 0.5 micrograms per kilogram per minute via IV or IO, and then, if necessary, increase to 0.5 to 1 micrograms per kilogram per minute every 3 to 5 minutes. A vasodilator of sodium nitroprusside in a dose of 1 to 8 micrograms per kilogram per minute via IV or IO for a child weighing more than 88 pounds, and for a child under 88 pounds, a dose of 0.1 to 5 micrograms per kilogram per minute via IV or IO. This concludes our third video on shock in children. Please proceed to the next video to learn more.